Bacalam contains a medicine called midazolam. Midazolam belongs to a group of medicines called benzodiazepines. Bacalam is used to treat a prolonged, acute, convulsive seizure in infants, toddlers and teenagers aged 3 months to less than 18 years. Parents or carers should only give Bacalam to a patient who has been diagnosed with epilepsy. For infants aged from 3 to less than 6 months, Bacalam should only be used in a hospital setting where monitoring is possible and resuscitation equipment is available. Bacalam is a liquid that is administered in the space between the gum and the cheek. This space is known as the buccal cavity. Bacalam is supplied in a pre-filled syringe contained within a plastic tube. Each syringe contains one treatment of the dose prescribed for an individual patient. Before use, always remember to check the expiry date stated on the box, tube and syringe labels and replace the product before it expires. Bacalam should not be used if any of the protective plastic tubes containing the syringes have been opened or are damaged, or if the date has expired. It is important to read the patient information leaflet provided in the Bacalam pack and discuss any questions with a healthcare professional before attempting to administer Bacalam. Keep the leaflet. You may need to read it again. Each syringe is colour-coded according to the prescribed dose for a particular age range. Your doctor will prescribe the appropriate dose of Bacalam for the individual patient. Do not pass the medicine on to other people to treat their children. It may harm them. You should always give Bacalam exactly as the doctor or nurse has explained to you. Bacalam is not intended for use with infants younger than 3 months old. Keep out of the reach and sight of children. Do not refrigerate or freeze. Keep the syringe in the protective plastic tube until use. When someone is having a seizure, it is important that you allow their body to move freely. Do not attempt to restrain any movement. You should only move the patient if they are close to immediate danger. For example, deep water, an open flame, or sharp objects. If there are other people around, ask them to stay calm and give the patient plenty of room, and explain that the patient is experiencing a seizure. Your doctor or nurse will tell you how long to wait after the start of a seizure before you can give rescue medication such as Bacalam. To administer Bacalam, cushion the patient's head with something soft. If the patient is already seated, you may find it easier to support their head against your body, leaving your hands free to administer Bacalam. Try to provide comfort and soothing words during the seizure, even if you don't think the patient can hear you. When they come out of the seizure, they may like to know that someone is nearby caring for them. Remove the syringe containing Bacalam from the plastic tube. Remove and discard the red cap from the tip of the syringe to avoid the risk of choking. Support the head so that you can administer Bacalam more easily. Gently pull back the patient's cheek, just enough to put the end of the syringe into the side of the mouth, between the gum and cheek. Angle the syringe to ensure the end is well within the buccal cavity. Slowly press the plunger to release the full amount of Bacalam into the side of the mouth. Don't try to squirt the liquid into the mouth or release it too quickly, as this may result in spillage. It may be easier to give about half the Bacalam dose into one side of the mouth and the other half into the other side. You should only give 1 dose of Bacalam. After giving Bacalam, keep the empty syringe to give to a doctor or paramedic so they know what dose has been given. Make a note of the time Bacalam was given and the duration of the seizure. Watch out for any specific symptoms, such as a change in breathing patterns. Do not touch the patient's mouth or put anything in it, including water, any other type of drink, or other medicines to treat seizures, because this could cause choking. It is helpful to loosen any clothing, ties, or scarves around the neck to make the patient more comfortable. A second dose of Bacalam must not be given without prior medical advice, even if the seizure does not stop or if the patient vomits or salivates. Call for emergency assistance. Be calm and stay with the patient until the seizure is over and they regain consciousness. They may be tired, confused, or embarrassed. Reassure and comfort him or her while they rest. Telephone for an ambulance immediately if the seizure does not stop within 10 minutes after giving Bacalam. You cannot administer Bacalam or cannot give the full prescribed dose. The patient's breathing slows down or stops. You are concerned about the patient. For full information on Bacalam, please refer to the Patient Information leaflet.